So what are the risk factors for cancer? Okay, age matters. So let's take a look. So this is the age at the time of the cancer diagnosis, and you'll see that most people are around 60 or greater when they're diagnosed with cancer. And these are the different types of cancers that they're diagnosed with. The line in the middle is this is the average age. So, what's this? 67 or something like that for the diagnosis of lung cancer, for example. When you get your transplant, how old you are when you get your transplant also matters. Okay, so as you go down, these people are developing cancer. So if you're greater than age 60, you're much more likely to develop cancer than if you're less than 50 years old when you get a transplant. So as you get older, these are the things that you actually need to be thinking about. And the number of years you've had your transplant also matters. Okay, so this is the number of years from heart transplant, for example, and these are the cancers, and these are the average. So you tend not to worry about cancer in the first couple of years of transplant, but after the first couple of years, you do.
Now, is that because of the drugs we're on?
Hold that thought.
Okay.
Do the numbers drop off after 17 years of transplant, or is it that the data isn't there?
So depending on the type of transplant, so for example, if you have the type of transplant, for example, it's okay. If you have, for example, a lung transplant where the average survival for a lung transplant is 5 years, then you're probably never going to get to 17 years of data. Right?
Well, some of us here, I'm 17 and a half years out,
Right.
Jim is 20-some years out.
Agreed. And
So
you
are
guys
we
are absolutely
beyond
special.
the danger range, or is it just not data?
There's a lack of data for people who are very, very, very far out because they are very, very special people. Okay. I'm being serious. You guys are definitely blessed. Okay.
I have a question.
Sure.
Is there a way to prevent cancer from happening?
Yeah, it's tough, we haven't figured out the best way to do that yet. I'll talk a little bit about the things that we're trying to do, but, if you grow up and you figure out how to do that, you will be a very rich and lucky young woman.
Famous person.
Very, very famous.
She wants to be a scientist.
Oh, so great. Gender matters, okay? Men are much more likely to get cancer than women are. So these are the men and these are the women. And this is, as you go down, it makes you more likely to get cancer.
Do we know why?
No. And if anything, you would think it would be the other way around, actually, but not so. So that was Penn's data, and this data is true all over the world. And this is, it's sort of written a little bit differently, but, these people, as you go up, you have more cancer. So men have more cancer than women do, all over the world. What about race? Does race matter? And it does. So if you take white people here in the red and non-white people up here, white people are much more likely to get cancer than non-white people. I will say, however, that if you take skin cancer out of this, there is no difference. Okay? All right, and then it matters if you've had cancer before. If you had cancer prior to getting a transplant, you're much more likely to get cancer after. It doesn't have to be the same cancer, right? But you're much more likely to get any cancer after. And how long you're cured from a cancer matters. So if you've had cancer in the past, if you've had, for example, prostate cancer 5 years ago, you're going to do better than if you've had prostate cancer 12 months ago, for example, if you then get a transplant. So the take-home points of the risk factors: older age at time of transplant, male, gender, prior smoking we didn't talk about, but it is true. A history of cancer prior to transplant, and immunosuppression may matter, and we will talk about that. So why does cancer matter?